Okay, so I know you said to me a little bit earlier that it's been a while since you've had a routine checkup at the dentist. How many years would you say it has been?
Uh, Over 4 years, roundabouts, I'd say, maybe. Do you mean like a routine checkup or as in go with no problems? Because I don't think I've ever done that.
Right, okay. So each time you've gone to the dentist, it's because there's been a problem.
Yeah, I haven't ever been without a problem. I've gone just because a problem's happened.
Okay, so did you attend regularly when you were a child?
Yeah, looking back now, I did occasionally go.
Okay, and do you have any sort of worries about going to the dentist? Any fears about going to the dentist?
Not in general. It's just not a very pleasant thing, really, is it? I just need to get the pain gone, sort of thing, and then it's okay. Yeah.
So when we say attending routinely, normally that's about once every 6 months, just for a checkup, just to check everything's okay. So what would you say the main reason is for yourself that you're not able to do that?
Well, if I don't really have any pain or anything like that, then I don't really necessarily like going to the dentist anyway. So I think, well, there's no real need. I just think it's unnecessary.
Okay, you yourself, even though it's nobody's favourite place to go, I can appreciate that. Everyone feels the same. But you are okay going to the dentist when you need to go. Is it more that you think that there's not a problem?
Yeah. I wouldn't want to go, just because, kind of like, yeah, I don't want to do stuff like it's only emergencies.
If, say, you had a checkup booked in with a dentist, would you be able to go for that or not?
I mean, I've never had any, but if I did, if I had booked an appointment, yeah, then yeah, I would turn up.
Okay, so you're not keen on going. Your sort of worries or anxieties, would that stop you from going?
No, not necessarily. For me, if my teeth are perfect and stuff, and I'd been going all the time, work would need to be done. But I think now, if I go, they'll be saying, well, this needs to be done, that needs to be done.
Okay.
So nothing is really hurting at the moment, but I suppose that's why there's in such a bad state because I couldn't take up that stuff years ago, if you know what I mean.
Yeah. So it sounds to me like there's a bit of anxiety and a little bit of worry, for want of a better word, and embarrassment, and not thinking to go unless you're in pain. Yeah. Which of these three would you say was the main thing that would stop you going routinely? Is it that you're anxious or possibly embarrassment or possibly you're embarrassed and that would stop you going? Or is that you just don't see the point in going unless you're in pain? What do you think comes first to you?
I think like anxiety, embarrassment, that sort of thing, yeah.
Okay, so we're going to look through this in a bit more detail later on, but there are 6 main barriers in these booklets that we've identified that are the main things that stop people from going to the dentist. We're going to focus on one of these today. So if you look at these, which one do you think is the main sort of one for you?
Yeah, well, we did say them three.
Yeah. Out of these 3, which one do you feel is more relevant to you, how you feel now?
Like it's these two, but to be honest, I don't know if it's this or that.
Okay. Well, you're going to take all of these home, so you're going to be able to go through all of them. Okay. But would you say if you had an appointment booked tomorrow, would it be the anxiety that would stop you or the embarrassment?
Um, I think it'd be this one. It's tough though.
It is. It's hard. Is it an equal mix or are you swayed more from one to the other? What do you want to focus on today? Which one?
This one, yeah, this one.
Okay, so I'm going to show you a quick video. And what I want you to do is when the video is finished, I want you to tell me if you can relate to anything in it or is there anything in this video that you agree with, okay?
Hi, I'm Mike from Walton in the Liverpool area and I have major self-confidence issues with going to the dentist. In October 2018, I joined a community group to try and help others to get them back into the dentist and along the lines try and help myself get back there too. Inner child for me is, it's how I feel when I'm outside of the dentist. So I picture myself in a suit because that's what I wear to work, with my briefcase, looking up at the sign, looking at the door handle, and it's just not somewhere I want to go in. I just don't want to do it. So I go from being a 38-year-old man standing there in a suit with a briefcase in his hand to a 2-year-old with a suit draped around me and not being able to hold the briefcase up because it's too heavy. And that's what it feels to me, the thought of going to a dentist. And I know I shouldn't feel like that. I feel like I need to go in and I say, I'm sorry. I'm sorry that you have to kind of deal with this. I know it's your job, but it could have been an easier job if I'd have come in and had better mouth hygiene. And it's that embarrassment that I'm going to go in and they're going to look at me and think, oh, he should be all right. And then they look and they go, God, what's gone on in there? I think what gives me more confidence is just generally talking about my issues. It's airing them out. It's getting them out there. I don't think it really makes any difference whether it's oral hygiene or if it's my well-being or illnesses or anything. I think we're always better when we talk about it. I think if there's one thing that grows my confidence is speaking to others, best practices, best stories, what people have done, hearing that people have just bit the bullet and have just gone and they've never looked back and they just wish that they'd have done it earlier. I'm 100% one of them people, 100%. When the time comes where everything's perfect in my mouth, I wish I'd have done it earlier.
Okay, so is there anything in there that Mike said that you agree with or you can relate to?
Yeah, most of it.
I think a lot of people feel the same about going to the dentist. A lot of people worry about what the dentist is sort of going to think of their teeth, and it isn't really something that many people speak about. So I think showing that you can sort of see what people think about going to the dentist and realise that people are in the same position as yourself. It's not just you who feels like you do. So this is our intervention pack. You're going to take this pack home and in it are 6 barrier booklets. As we said before, we're just going to focus on this one today, the one you chose, the embarrassment booklet.
Yeah.
So one of the things to really think about when it comes to how you feel about going to the dentist is it's quite a common thing for people to feel like people don't want dentists to see their teeth.
Really?
One of the things I really want you to remember is that I'm a dental nurse and we look at people's mouths all day. Most dentists become dentists because they want to help people. It's not a case of they don't just look in people's mouths and judge, which is one of the things that Mike was saying in the video. He was scared that the dentist would look in his mouth and think, oh no, what's gone on here? But it really isn't the case. What a lot of dentists are doing when they look in a patient's mouth is thinking, okay, what treatment does this patient need to make them better?
Yeah, I get what you mean. If they're not looking at my mouth, they're looking at somebody else's.
Yeah, that's it. They're looking at mouths all day, every day. You build up a rapport, you begin to feel more comfortable. That's the best thing you can do. If you're feeling anxious or worried, all you need to do is to speak to the dental nurse or the dentist and just be able to say, you know what, I'm not a big fan of coming here and I'm quite, embarrassed about the way I feel. I'm not a fan of looking in people in my mouth. And because of that, they can sort of work out a way to accommodate you, to help you to feeling a bit more less uncomfortable. We can try and do things to make you feel a little bit better, even if you feel a little bit more reassured.
Yeah.
And if you've got a dentist that you see in every 6 months just for a checkup when everything's okay, the chances of you needing an emergency appointment like today is going to be greatly reduced.
Yeah, I see it because I wish I'd done all of this like years ago. I wish I'd have gone at the dentist all the time and I would have had braces and that. I just think all that stuff you should have done affects you now.
Yeah, I completely understand. I didn't have braces when I was a child and I really do regret it so much now.
Yeah, I mean, I don't know. I wish, but it was just something I didn't do.
Yeah, it's a routine. It's a routine you've never been in. It is hard.
Like, I don't want to blame my parents or anything because it's kind of, they told me to brush my teeth and that. And I just didn't, and that's not their fault. Flossing and things like that. I didn't know about all that, until recently.
Yeah, okay. And it's one of them things, if you don't go to a routine dentist and they can give you that advice and explain things, then, and to say, I've not known about flossing my teeth and I don't know why I need to do it. They can give you all that information. Even though you didn't go years ago, it's not too late to start getting into that routine and to start getting that advice on your oral health now.
Yeah, I get you.
If you went for regular checkups and got any treatment that needed doing, then every 6 months, all you would need doing is a check that everything's okay and that everything's fine. And, if you get a dentist that you feel comfortable with, that would hopefully make these visits feel a lot easier because you just go in to check everything's okay. And more than likely it will be okay because you've had the treatment done and you're just checking that everything's all right on a regular basis.
Yeah, that makes sense.
And then if you keep having regular checks, the likelihood of needing treatment is a lot lower.
Yeah, I guess it is.
Because when you're going regularly, you will get things checked. Anything going on is caught early and all the treatment is kept to a minimum. Hopefully having treatment that you need done will make you feel better and make you feel more confident, even though you're not a big fan of going. If you go and get it done, people who have been a little bit embarrassed beforehand after treatment, it tends to help the confidence a little bit.
Yeah, I can see that.
So I've got a list of dentists here that are currently taking on, or some have got waiting lists. I've got an NHS waiting list or a private waiting list. Would you be looking at NHS, both, or?
Yeah, I definitely like NHS.
Okay, all right. So this is the list. So these are the ones here. And also you can go to a dentist anywhere as well. It doesn't have to be the one closest to you. So if there's anywhere that you're willing to travel, somewhere around maybe by where you work, or, you know, somewhere close, it doesn't have to be close. You can travel around. You can just call and register for an appointment, okay?
Yeah, okay.
So we'll make this a plan. I'm not suddenly going to expect you to go skipping into the dentist. Just small things that you think would help, small things that are achievable. So thinking about when you would like to be registered with a dentist or have your next appointment, what sort of time frame would you like to give yourself?
Yeah, so I mean, hopefully this week I'd like to get registered, but I don't know how long it takes, you see. I don't even know if people are taking patients on or things like that. I don't know. I mean, today, yeah, I could phone up today.
Yeah. Okay. So look at the list. I think a week is absolutely fine. It gives you a bit of a better idea. You know, I think that's a good time frame. Practices will be booked up probably for weeks in advance. So phoning now, booking ahead and planning it is the best way forward.
Okay, so this week start calling.
Yeah, if you just write that down there.
One week for setting an appointment.
Yeah, or registering at a practice at least.
Yeah.
Okay, brilliant. And then if we flip over here, is there anything that you think that's going to help you? When it comes to dealing with your barrier, is there anything that you think that may help you overcome the barrier of your embarrassment?
Speak to the dentist maybe, I don't know, for them to reassure me. I mean, even then, but even though it's still like, even when you're reassured, well, really you think, well, obviously you're going to say that.
Yeah, that's the trust thing, you know, and hopefully when you start going every 6 months, you'll build up that sort of relationship with your dentist and you will learn to trust them and you'll be quite open and honest with them because you're their patient and they will want to help you.
Yeah, so I'll say so and by speaking to the dentist.
Yeah, if you think that would help, yeah. And then thinking about what would work for you, is there any sort of time that you think you can dedicate to attending the dentist? Any sort of day in the week in particular?
Well, currently any time's all right at the moment, yeah.
Okay, so anytime you're quite flexible. All right, if you just bob that down in your plan as well, that's good to know. And also, is there anyone you can speak to about this? Is there anyone who can support you? Anyone outside that you can talk to about this?
No, not really, I don't think.
No, okay, that's fine. Just pop that down. Sometimes there isn't. This is the next appointment toolkit. This has also got lots of information on preparing yourself for your next appointment. That will be quite useful. I'd have a good read of that when you get home. Also, if you are feeling anxious, there's some good tips in there as well, which can really help. Okay. And that's you done for today. You've done really well today. Talking about things is hard, particularly when we're talking about things we don't like doing. You've taken the first step in addressing this. Now you've got a plan on how you can get over it.